What we know is that people who have a higher dependence on nicotine, and that can be sort of approximated or estimated by how quickly somebody needs a cigarette in the morning. Basically what happens is when you go to sleep at night, your levels in the blood of nicotine go way down. So in the morning you need to replenish. Those who need the nicotine the most will smoke earlier. And the thing that these researchers wanted to find out is by, figuring out who has to smoke that soon, are these people also taking in more of the toxins that are in the smoke? And based on the results, it appears that this could be the case.
Oh, so they're taking in more of the toxins. Is there a direct relationship to taking in more of those toxins and these particular kinds of cancers?
Yes. So in other words, the more exposure to a cancer-causing chemical, theoretically, the higher your risk of getting that cancer. Although I must say that there is no safe dose. So just because you smoke, let's say, 1 cigarette a day, it doesn't mean that you are immune to cancer, but your risk may be smaller.
Okay. Everybody knows they should quit. I mean, as an ex-smoker myself, I know how difficult it is to quit. But do you have the same risk if people were to say, okay, I can't live without the nicotine, I must take some sort of nicotine replacement therapy? So that includes nicotine. Do they still have the same risks?
Well, no, because the cancer risk that we're discussing it comes from the cancer-causing chemicals in the smoke. Nicotine is not one of those chemicals that cause cancer, and therefore, we typically say that it's much better for someone to be on nicotine replacement, whether it's the patch or the gum or the inhaler. There are a lot of different ways to get nicotine replacement. Better to be on that for the rest of your life than to ever smoke again.
Okay. What if somebody says, okay, then I'm going to cut down and I'm going to try to eliminate that cigarette I have first thing in the morning? What if they want to go that route? Does that help at all?
Well, according to this research, that isn't necessarily going to be helpful. What the indicator is here, when we talk about people who need nicotine that early, it's a marker for a type of smoker, perhaps a smoker who inhales more deeply, who holds the smoke in their lungs for longer. These are people who are theoretically getting more exposure to the cancer-causing chemicals because they need to really boost the levels of nicotine in their blood.